Good morning. This is my random video for the thorax and lungs assessment. So, good morning, sir. My name is Joseph Pospos. I'm your student nurse for today. May I know your name, please?
I'm Froilan Dennis.
Good morning, Mr. Froilan. I am here to do a thorax and lungs assessment to find any underlying problem or potential problem within your thorax and lungs. So, in this procedure, sir, I will be touching you. Would that be okay, sir?
It's okay.
Alright, so first thing we'll do is we will wash our hands. Alright. Then inspect for the patient's posterior, lateral, and anterior of the chest. So let's provide privacy. Alright, so let's proceed with the inspection of the anterior, posterior, and the lateral chest of the patient. Right, so while inspecting, we will be counting the respiratory rate of the patient. Alright. So the patient's posterior and lateral and anterior ratio is 1:2, and costal angle is less than 90 degrees, and symmetrical appearance in the rise and fall of the patient's chest. Then the respiratory rate of the patient is 19 cycles per minute, which is normal because the normal value is 12 to 20. Then the rhythm is regular. And sir, please po dungok kariyot, sir. Anak lang, sir. Anak, sir. So hips are level and symmetrical. Then okay na, sir, please continue lang, sir. So patient's spine is straight and no lateral curves. So next thing we'll do is palpate for the patient's trachea. So we'll put on our gloves before palpating to prevent transmission of microorganisms. Alright, so in palpating, first thing we'll palpate the patient is the trachea using our thumb and our index finger. Palpate for the trachea's position. So trachea is midline. Then next thing we'll do is palpate for crepitus and tenderness. Sir, if ako ikon, sir, inakog may sakit, sir, ha?
Sige.
Wala na yung sakit, sir. So next thing we'll do is the posterior. Inakog may sakit, sir, ha?
Sige.
Wala na, sir? So, no tenderness or crepitus or deformities that is present. So, next thing we'll palpate is for the patient's respiratory excursion. Sir, please kung ginawa yung normal, sir. Alright, let's proceed to the posterior. Sir, ginawa ng diapon, sir. So, patient's respiratory excursions is symmetrical. Then, next thing you will do is palpate for the patient's tactile primitus. So, sir, every time mo ako, sir, tingot storya 99, sir, ha?
99. 99. 99. 99. Constipation. 99. 99. 99. 99.
So, in palpating the tactile primitus, we will use the ball of our fingers, a ball of our hands. So, tactile primitus is bilateral and symmetrical and diminished in the mid-thorax. So, next thing we will do is the percussion. So, in percussing, I will remove our gloves so we will hear the sound better. So, sir, baka sir, hinaw kong kamot, sir. Resonance, 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 resonance to dull, dull, dull. Then the lateral, etc. Yan na yung kamot, sir. Pwede kang i-cross lang nila, sir, para hawak. Resonance, resonance to dull, dull, dull. So the posterior, sir. Resonance, 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 resonant, resonant, resonant to dull, 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 right, dull. So next thing you will do is purpose for the patient's diaphragmatic excursion. So sir, pag kuan sir, may nang ginhawa siya, ginhawa, inhale sir, then exhale fully sir, then utong.
Sige.
Sige. 1, 2, okay, exhale. May utong sir. Resonance, resonance, resonance. Right down. Then we'll use our marker. Ang ginawa na sir, tarong sir. Di, wala pa. Di na sa sir. Then we'll proceed with our second mark. So sir, same nagyapon sir. Ginhawa, then exhale fully sir, then utong. Sige sir, 1, 2, 3, go. Inhale sir, then exhale fully, then utong. Sige. 1, 2, 3, go. Resonance, resonance, resonance. Right, down. Alright. This is our second mark. Then we will, kaya sir, ginawa na tarong sir. Then we'll measure with our ruler. So 5 centimeters. Then let's do it on the other side as well. Sir, parihara gyapon sir. Ginawa, then inhale sir, then exhale fully sir, then utong. Sige. Resonance, 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 done. So put our first mark. Ginawa na tarong sir. Then next thing we'll do is for the second mark. So same magyapon sir, inhale, then fully exhale, then utong. Okay sir. Okay. Resonance, 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 done. Then we'll put our second mark. Malaki dun si mo ito.
Iya, papikan.
Malaki ito pa. So measure. So the other side is 5 centimeters as well. So patient's diaphragmatic excursion is symmetrical on both sides. Then after, so the next thing we will do is auscultate the patient for any underlying abnormal sounds. So we'll need the use of our stethoscope. Then sir, please hold ang gamay sir ha. Sir, gamay. Alright, ginawa na sir. Alright, bronchial, 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 bronchovesicular, 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 vesicular, 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 vesicular. Then we'll proceed with the lateral. sir. Kamot niyo mo, sir. Pili ko i-cross lang, sir. Okay, para sir. Alright. Bronchial. Bronchovesicular. Vesicular. Vesicular. Then let's proceed to the posterior. Sir. Bronchial. 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 Right. Bronchovesicular. 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 Vesicular. Vesicular. Right. Vesicular. 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 Alright, so no adventitious sound was heard. No crackles, wheezing, or rubs that is heard. And lungs are clear upon auscultation. Then next thing you will do is for test for abnormal sounds using egophony, bronchophony, and whisper, pectoriloquy. So first thing we'll do is the egophony. Sir, please call every time mo auscultate to, sir, ingog E, sir, ha?
Sige.
Right.
E. 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 E.
Alright, so soft and muffled sounds were heard, and is sounds like upon the affected area. The next thing we'll do is the bronchophony. So sir, ingon og 1 2 3, sir, every time kada auscultate ako, sir, ha?
Sige. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Alright, soft and muffled sound and can be distinguished. And next thing you will do is the whisper pectoriloquy. So, sir, ihunghong lang, sir, ng 1 2 3, sir.
Sige.
Alright, so soft and muffled sounds were distinguished and can be distinguished. Then after the assessment, we will wash our hands. Then document the data that is found in your small notebook. That will be all. Thank you.